Today, we're delving into a topic that's on the minds of many: dental implants. Are they right for you? I am Dr. Taj. I have years of experience under my belt with dental implants. The crux of our discussion, understanding if you're the right candidate for dental implants, because let's face it, not every solution is a one size fits all. So get ready as we explore the ins and outs of dental implants. First off, what exactly are dental implants? Well, in simple terms, dental implants are essentially titanium screws that act as artificial roots for missing teeth. They are a reliable and long-lasting solution for tooth loss, whether you're missing a single tooth, multiple teeth, or even an entire arch. But how does it work? Once implanted into the jawbone, these titanium screws go through a process called osteointegration. This is a fancy term for the bone healing around the implant, securing it firmly in place. This process is crucial to the success of the implant. It takes anywhere from 3 to 4 months to complete. So dental implants are not just about replacing lost teeth. They're about restoring the functionality and aesthetics of your smile while preserving your oral health. Now that we know what dental implants are, let's talk about who is a good candidate for determining if you're a good candidate for dental implants. Involves a few key factors. First and foremost, a good candidate is generally a healthy individual both overall and this means that your gums should be free of disease and your immune system should be in shipshape to handle the implant procedure. Secondly, adequate bone quality and quantity in your jaw is crucial. The titanium screw, which acts as the new tooth, needs a strong foundation to integrate with and to support the earth. However, there are some red flags to keep in mind. If you have uncontrolled diabetes, this could complicate the healing process post-surgery. Additionally, certain medications like Fosamax and Boniva, which are known to inhibit bone growth, could potentially affect the success of the implant. Now, you might be wondering, does age play a role in all of this? Robots find out. You might be wondering, is there an age limit for dental implants? The simple answer is no. There's no strict upper age limit. In fact, many seniors enjoy the benefits of dental implants. However, age can affect candidacy, particularly for younger individuals. For males under 25 and females under 21, their jawbones may still be growing. Implants before full growth can lead to complications. So while age isn't a definitive barrier, it's an important consideration. Now let's move on to another factor that might affect your candidacy: smoking. So you're a smoker. Does that mean dental implants are off the table for you? Not exactly, but it does complicate things. Smoking can hinder the healing process after implant surgery, reducing the chances of success, but don't lose hope just yet. There are ways to work around this. Nicorette patches, for instance, can be a helpful tool. Smoking cessation programs are also an option. These strategies can boost your chances of successful implant integration. Apart from these, there are a few other factors that could disqualify someone from being a good candidate. There are a few other things that might prevent you from being a good candidate. For dental implants, for instance, poor bone quality can make it difficult for the implant to integrate properly. Additionally, poor oral hygiene can lead to infections that compromise the success of the implant. If you lack motivation for proper dental care, this could also disqualify you. Remember, implants require as much care as natural teeth. Now that we've covered the basics, let's talk about how we evaluate whether you're a good candidate. So how do we evaluate if you're a good candidate for dental implants? Well, it starts with a cone beam scan, a non-invasive technique that gives us a three-dimensional image of your job. Of assessing bone strength and quality is crucial for implant success. But it's not just about the scan. It's about sitting down and having in-depth discussion with your dentist, aligning your individual goals with the right treatment options. With all this information, it's time to make your move. If you're considering dental implants, don't hesitate to take the next step. It's essential to get a personalized assessment and more information tailored to your unique situation. Remember, the first step towards a healthy, confident smile is just a call away. And that wraps up our discussion on dental implants. We've explored what they are: candidacy, age, and smoking considerations, other factors that may disqualify you, and the importance of a thorough evaluation. Thank you for joining us today. Remember, making an informed decision about dental implants is crucial to your oral health. Until next time, take care.